Hey GP learners, so we're just wrapping up from day 2 of the RCGP Annual Conference here in Liverpool, and it's been an interesting day, hasn't it, Andy?
Yeah, it's been a fun day. We kicked off this morning with the plenary, did a few sessions, and then I think the most interesting thing in the morning was the Q&A session. I thoroughly enjoyed that.
Yep, it was nice to hear responsive questions, and they had some last-minute substitutions with Dr. Bex Fisher jumping in because one of the other previous speaker was unwell. In addition, we had Dr. Nikki Kanani, Professor Martin Marshall, the chair, and Artie Bansal working on the Green project and stuff. So really nice Q&A section, which covered a variety of things, including the inevitable letter from Sajid Javid and the responses to that, which I do feel was responded appropriately and a measured response, I think.
I think so. I mean, I think it was very good of Nikki Kanani to turn up when Sajid Javid didn't turn up. I think there wasn't really any choice for her not to turn up, and I think she did well. I mean, I think her hands are tied really in terms of what she can say because she's currently in role with NHS England. So we might have heard different things from her if she was speaking, not wearing that hat. But yeah, it was good, robust debate around it, some good questions. I think the new way of asking questions in the app, with questions being visible to all and upvoted by everyone else who's looking at the app, worked really well for that session. Really good quality questions, less waffle.
Definitely, less waffle, more effective, I think, at getting a variety of questions. Slightly annoyed my question they get asked, but hey, that's the downsides of it.
You need to construct a better question, Gandhi. It didn't get upvoted enough.
It was pretty simple. It was like, when are we going to see the change to the Cahill formula? But hey, obviously I think that was probably more for the GPC to answer than anything else.
Yeah, and actually the session on the inverse care law I found really, really good, which was the other session that we attended this morning.
And that was actually led by Dr. Bex Fisher and Dr. Rachel Steen from the Fair Health podcast and various other things that they both do together in terms of tackling health inequalities, and really eye-opening session in terms of the challenges that health inequalities face for practices and their patients.
Yeah, and a challenge to the system and government and our local ICSs in terms of, are we serious about levelling up and tackling health inequalities? And if we are, we need to do something around the funding models.
After that we had lunch, which was an okay experience this time compared to yesterday. And then following that we had our own session, wasn't it, Andy?
Yeah, it was good. It was great to see people who, a lot of people there seem to recognise us from the work that we've both done on the internet, which is fantastic. Really nice to connect with people and get some positive feedback about the session. Yep.
Definitely, it was nice to hear from everybody that they felt it was useful content and stuff in terms of talking about content creation, basically, and how you can engage your communities and other places more effectively using things like social media and other tools that we talk about quite often on our stream. So hopefully you've all found that useful. We kind of showed our process for creating episodes, which we did this morning, which is the episode that you're going to get tomorrow, talking about that funding letter. So definitely make sure you click on to watch that tomorrow morning at 11 o'clock as we go through the lovely funding letter to improve access to GP practices and supporting GPs and stuff.
And finally, we've just come out of the plenary session, and it was great. Some good closing words from Amanda Howe, who I think has been an excellent president in a very unusual period of time for everyone, including her being president, I think.
Absolutely. She recognised that it's a different type of presidential post that she's had. Normally they go out and see practices, see the faculties, all that kind of stuff, and obviously a lot of that had to pause because of COVID, but a nice little handover with a bit of a pun in there as well about virtual versus face-to-face, because Claire Gerarda, the new president starting from next month, was unable to attend face-to-face, so had to zoom in.
It's great to see Claire back, and hopefully she'll bring some of the qualities that she showed engaging with the media when she was chair, sort of back to her contribution to the faculty to the college as president, because it feels like there's some tough times ahead, and that's good. Hopefully she can represent as well as she has done in the past.
Yeah. So that's our wrap up of the RCGP Annual Conference. We're about to head over to the train station to head back to Nottingham, and then, as we said, we've got our content coming for you tomorrow and a variety of stuff coming shortly after that for all of you. We hope you really enjoyed this kind of unique opportunity for us to cover the conference, and you never know, we might be back next year as well, so watch this space for that side of stuff. If not, as always, we've got our other content and everything else for you to enjoy, share, and basically use as you want, really.
So so it's time to close off on the conference. So thanks very much for watching our content.
And as always, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode. See ya.